Hello guys, this is Dr. Palani Pramanikam. In this video, I'm going to answer all your questions about water and fasting. How much water you should take, what is the type of water that you should take, whether drinking too much water is bad for you, can you drink water before meals? We're going to answer all these questions in this video. Let's dive deep into it. If you have been following my channel, by this time you might be aware that I promote time-restricted feeding, which means that I encourage my patients and my followers to follow circadian rhythm of eating. That you start eating after sunrises and you stop eating after sunsets. So we need at least a minimum of 12 hours of rest to our stomach. If you can extend from 12 hours to 16 hours, it is well and good. The important trick to extend the eating window is by using water. I drink water a lot. For example, when I started this method, I started from 8 a.m. to 8 p.m. slowly. And instead of cutting down my dinner time, I started to extend my morning time from 8 a.m. to 9 a.m. That 1 hour, I was really hungry initially, but then I started drinking water, which I was able to extend my eating window to 9 a.m. So from 9 a.m. to 8 p.m., I was able to decrease my eating window to 11 hours. Then slowly I increased from 9 a.m. to 10 a.m. Then it became a habit for me without using much of my willpower. Then I started cutting down my dinner time, right? So from 8 p.m. I started cutting down to 7 p.m. When I did that, the significant issue that I had was I started feeling like hunger in the middle of the night. Because I've done some research in this field, I know that thirst can also confuse you like hunger. So I always had a water bottle right next to my bed. So let's say when I wake up around midnight or 1 a.m. thinking that I'm hungry, right away I used to drink from the water bottle, maybe 500 or 600 ml, and I will wait for 15-20 minutes to see whether the hunger like feeling is gone. You'll be surprised that more than 95% of the time it was just the thirst and not the hunger. So it is absolutely important for you to differentiate between thirst and hunger, especially when you are following this time-restricted feeding method. My friend Arun Agamot does not have any problem at all because he easily differentiates thirst and hunger. He drinks water for thirst and liquor for hunger. He mixes both together. So what I am promoting is a type of intermittent fasting called time-restricted feeding. There are other kinds of fasting, including dry fasting, just water fasting alone. Let's just look into the pros and cons of this approach. Number one, dry fasting. When you say dry fasting, which means that the person will not eat anything, will not drink anything, they will not have anything into their GI tract for 24 hours, 48 hours, 72 hours. The major advantage of this method is because you are not giving any calories to your body at all, your body is forced to use the stored calories as fat, and this could be an effective fat loss tool. But the problem is this is not practically possible. The biggest drawback of this method is there is no hydration at all. Hydration is absolutely critical to sustain your hormones. When you go for extended period of time, this can lead to significant amount of dehydration and also to other problems affecting your cognition. So it is generally not recommended as a sustainable method. Number two, water fasting. Many people adopt water fasting, which means that when they decide to do fasting, they will just drink water throughout the day. I've seen many people, including my family members, doing just water fasting for 24 hours, sometimes for even 48 hours. If you want to do it, please start slowly. Do not extend to 24 hours or 48 hours. In my practice, I do not recommend my patients to do it because I don't believe that extremes work, especially if you want this to be sustainable. If you want to do it occasionally, maybe once a month or once in 2 months, it is okay, but definitely not on a long term. One study shows that well-nourished adults can sustain only on water for 7 days to 9 days to even 10 days. But there was significant amount of metabolic derangements, including increased ketones, increased uric acid. There were other significant electrolyte abnormalities which forced the investigators to stop the investigation because of the concern that this electrolyte abnormalities can affect the whole bodily function significantly. So again, if you follow my channel, we always believe in sustainable methods. So I do not think that water fasting on a regular basis is going to help in a sustainable way. Why I keep talking about water is hydration is extremely critical, especially for our digestive hormones. It helps in removing the toxins naturally through the bodily process. My friend Samana Kumar is saying, a glass of water cannot even remove a coffee stain on the shirt. How can it remove the toxins from the body? I said it can help remove toxic people, Ra. He asked me how. I splashed the water on his face. So if digestive hormones needs water, then how much amount of water everybody should drink in a given day? So multiple research studies have narrowed it down to as soon as you wake up, you should drink close to 240 ml to 250 ml every hour for the first 10 hours. For example, you're waking up at 7 a.m. From 7 a.m. until 5 p.m. every hour you should drink around 240 ml, which will lead you up to 2400 ml of water, which is around like 2.5 liters of water per day. This excludes the fluids that might be included in your tea, coffee, or any other food intake that you might be taking. If you're exercising, you might have to take a little bit more. The reason that you should limit your consumption of water after 5 p.m. is similar to how we go to sleep at night and we wake up in the morning. Even the cells in the kidneys also goes to sleep after sunset. So when you're drinking water after 5 p.m., you are waking up the nephrons in the kidneys and they need to do the job and they will excrete water for you, which will in turn make you urinate in the middle of the night, which will disturb your sleep. So in general, what I recommend to my patients is that limit your water intake to 500 ml after 5 p.m. Make sure that you take 2 liters before 5 p.m. so that you will have a good quality sleep. So now it is very clear that everybody should drink around 2.5 liters of water per day. Then the question comes, what kind of water? Tap water, mineral water, or purified water? I would say it depends upon what location you are in. There is a concept called TDS. TDS means total dissolved solids, which means that drinking water can be contaminated with multiple kinds of solids, liquids, and other particles. This TDS meter will help you understand how much amount of impurities are present in the drinking water. It is a small meter you just dip into the drinking water and it will show you a number. If it is between 50 to 300, it is a reasonable amount. So it is pretty much safe to drink. In the US, in my home, TDS is around like 200 to 300. So it is relatively safe to drink. But in most of the Indian homes, TDS is usually more than 300, sometimes reaching like 600, 700. Sometimes using a purifier helps. The method that I adopt is called reverse osmosis. So where they use a semi-permeable membrane to filter the water so that the water can seep through and most of the impurities are being filtered. And this method is called reverse osmosis and the filter is called RO filter. I'm going to show you which filter I have in my home. So in my home in Chennai, I wanted to show you what kind of filter that I use. I use Native M2 filter by Urban Company, and they have this like beautiful system and they have this pre-filter as well over here, which uses the reverse osmosis technology and also the ultraviolet technology. So to make sure that I meet my daily criteria, I used to have a 3-liter water bottle and I will fill the water bottle right after I wake up using this reverse osmosis technique so that I don't forget or I will not have time to refill. So I have had so many instances that I have forgotten the water bottle altogether or did not have time to refill the existing water bottle. So I usually go with 3-liter water bottles. The other good thing about this is that they have an app which shows the TDS meter right away. So I know that it is between 50 to 300. If it is more than 300, it will give an alarm to me as well. So I am pretty confident that the quality of water is always safe. So let me show you how I use my app. The TDS of my drinking water is right here. The filter health is right here. And if I need to service, I can use this app per se. And I can track all the details, and I usually service this once in 2 years. I really don't have to worry about the quality of water that I'm drinking because the TDS value is right there. I use this in my house. If you're interested, please check out the link in the description. Then the biggest question is, can you drink water before meals? My mom says, don't drink water before meals, then you cannot eat that much. I said, I should not eat that much, mom, because I'm very big already when I was obese. The concept of drinking water before meals and the concept that you will not be able to eat that much is because when you're drinking water, it will distend the stomach. When the stomach distends, the signal from the stomach goes to the brain and tells the brain that, hey, there is something that is filling up the stomach already, so he might not be hungry, so you don't have to eat that much. This is a wonderful tool for weight loss, if you ask me. But I understand that there is a myth surrounding this concept that if you drink water before the meals, it will dilute the gastric acidic juices. There is no scientific evidence to support this statement because The stomach acidic juices does not depend on the presence of water to digest the food. Whether you have water in the food or not, the acidic juices will do the job. So there is no point of worrying about whether the water will dilute the acid. Even in the worst case scenario, if it dilutes the acid, it is so transient that it is clinically insignificant. So from today, don't worry about drinking water before meals so that you can reach a minimal requirement of daily water intake. The next question is, should we have to drink alkaline water? You should see all these alkaline water bottles in the supermarket where it is easily $10 or even like more than 1,000 rupees, suggesting that alkaline water is good for you. All this hype about alkaline water came from a small study in 2018 where they studied high performance athletes and they gave alkaline water for a while and their performance increased slightly over other athletes who were drinking normal water. And there is also a huge push to drink alkaline water, thinking that more acid in the stomach is bad, so if you keep it alkaline, it is better for you. I am here to tell you that your body is so smart than what you think. Your stomach is even more smarter. Your stomach will be able to balance the pH in a way that your body needs. If your stomach has low acid, it will secrete more acid to balance it out. If your stomach has more acid, it will secrete less acid to balance it out. Your stomach is a wonderful pH balancer. You don't have to worry about it. There is only a few proportion of patients who may benefit from alkaline water, which might not be applicable for general population. So in general, you don't have to spend that much amount of money for the alkaline water. It is not about what kind of water you are drinking, it is about how much water you are drinking. So next question is whether too much water will damage your kidneys. This is also a myth that has come recently upon social media. You should understand that your kidneys are also as powerful as your stomach. The more water you drink, your kidneys will be able to handle it, and that is why kidneys have something called nephrons, which is the renal tubules, which is able to filter the water and excrete in urine. The problem comes when you have chronic kidney disease or when you have heart failure, where your kidneys and heart is damaged already, and to a point that the doctors are recommending that you should not drink that much amount of water. Again, that belongs to a very, very few proportion of patients. In general, our overall population, you can definitely drink as much water as you can. At least drink minimum of 2 to 2.5 liters of water per day, as we discussed. The last thing you should know is how do you check yourself whether you are properly hydrated or not. So how I check myself is I usually pinch on the back of the hand, and when I let it go, if the skin goes back to its normal position in 2 to 3 seconds, it means that I am well hydrated. So look at this, I am pinching, I'm letting it go, and it goes back to the normal position without any wrinkles or anything like that in 2 to 3 seconds, which means I am properly hydrated. If it gets delayed for more than 5 to 6 seconds, which means that you are not meeting your water criteria for that day. This is a simple test that I usually do. You can do it like once every couple of hours and make sure that you drink water to meet your daily criteria. So from tomorrow, please make sure that you have to drink at least 2 to 2.5 liters of water per day. So in this video, we covered about how much water to drink, what kind of water to drink, and we broke all the myths surrounding water. Water is a wonderful tool. So in my method of proposed time-restricted feeding, what I do is I use water to extend the fasting window. So just drinking plain water can be boring. So you can make it interesting by adding flavored waters, by adding some cucumbers, some oranges, some lemon, so that can extend the fasting window with some kind of interest. So again, I completely understand when you start this method, it is going to be very, very difficult. But if you keep at it, it is going to get better slowly. For example, if you're finding it difficult to extend the morning eating window to like 9 a.m., you don't have to push yourself too much. Just start slowly with 15 minutes. For example, if your eating window is at 8 a.m. usually, just extend to 15 minutes to 8:15 a.m. and then see how you do. You will be amazed with the results. In general, the other way to check whether you are properly hydrated is checking the color of the urine. If the color of the urine is pale yellow to white, which means you are adequately hydrated as well. So I hope this video answers all your questions about water. I'm really hoping that you can use water as an effective tool to implement your time-restricted feeding and enjoy all the benefits of your circadian rhythm. Remember, one belly at a time, it is absolutely important. I'll see you in the next video.